Each year, Microsoft Research hosts hundreds of influential speakers from around the world, including leading scientists, renowned experts in technology, book authors, and leading academics, and makes videos of these lectures freely available.
So in addition to hardware devices proliferating, there are a ton of medical devices. And so Brad was really at the forefront of this. When he was in the Army, he used to train their surgeons in advanced imaging techniques and supervise basically how Army surgeons would learn. And now that he's a civilian, he's an ER doctor and helping design mobile ultrasounds. And he took all these medical devices that use iPhones and tablets. You can kind of thank him for it because he's the one who went through the pain of teaching the FDA that a mobile phone screen was better than one of those ultrasound screens that you've seen. He had to actually document that and prove it to them back in the day. So here to talk about kind of the future of healthcare is Brad Younger.
Thanks, Pete. So maybe we'll chat a little bit more about that in the breakout session if anyone wants to talk specifically about the FDA. That's probably hours of conversation in of itself and lots of gray hair, but I think we've come a long way since 2010 as far as that goes. But what I'm here to talk about today is somewhat relevant to my role as, in mobile ultrasound technology, but in medical hardware in general. Is I think we're entering a digital healthcare revolution right now. Healthcare tends to run sort of about a decade behind the tech community, but we're closing the gap and we're coming along with some new innovative devices which are going to change the way that we interact with our healthcare providers. One of the common thematics right now in healthcare is this sort of idea of patient-centered healthcare. People feel much more empowered to drive their own healthcare in the direction they want. It's much less hierarchical than it was even 10 years ago. Lots of more data you can control. You have access to your data. You can choose what data you want to learn about on your own. And so I think when we talk about where healthcare is going, I think that we're going to have patient-centered healthcare where there's lots of different types of healthcare providers, lots of different training and specialties and backgrounds who will help you, assist you with your healthcare, and using different kinds of medical devices to help catalyze that conversation. You know, is anyone familiar with this gentleman here? So just as a starting point of where innovation can come from, this gentleman was in China, and this kind of went viral a couple years ago. It was discovered through a YouTube video, that he had been self-administering dialysis from his house in China for about a decade. The reason was not that he wanted to do it per se, is that he couldn't actually afford what it cost to get down to the clinic in the city. So he went on the internet and basically built a home dialysis system. Was based in doing dialysis for about 1/10 the cost that it would have taken him to go down to the city to do it. So there's lots of do-it-yourself hardware innovations going on. This is maybe an extreme example, but to say that sometimes need can drive innovation. But along with that, you know, we need to remember that there's a regulatory component. And this is my sort of one sort of slide about FDA regulatory components, because a lot of people don't have to deal with that. But does anyone remember either of these images here at all in the past? So the one on the left is the Relaxicizer. So it was in the 70s. The idea was you would strap that to your body at night, and then when you woke up in the morning, boom, you'd have lost 10 pounds. So that went for about 5 years unregulated, and lots of those were sold on the market, and there was very little regulation from the government about whether that was actually a valid medical device. Of course, it was not. And then on the right, or my right here, is a much more sort of probably tragic story of lack of regulatory oversight. So what this here is a shoe video or shoe fluoroscopy machine. So in the 70s, these became popular for customizing your shoe size. So you'd go into the shoe store and you would put your foot in there and you'd see an x-ray of your foot, and somehow you would actually be able to customize your shoe size better than before. There were a lot of tragic outcomes of this. These were banned in the 70s. However, the last one was found in use in 1983 in West Virginia, still being used. But can anyone imagine who were the people most affected by this device? Yeah, the shoe salesmen were a lot of where the case reports came from in the medical community about because they were exposed to this on a day in, day out basis for years. Loss of limbs, lives significantly affected, quite a tragedy and an example of how a lack of regulatory oversight can really have a negative effect on people. So I'm going to talk a little bit about ultrasound because that's where I spend a lot of my time. And then we'll move into some other medical devices. Some of the medical devices I'm going to talk about you may own, you may know about, some you may not. I think a lot of them, and hopefully the ones you are familiar with, we can maybe talk about some different kinds of ideas of how those connect people and connect their health care with their doctors and physicians. So now in the space of ultrasound, we develop probes that actually sit on your finger, so it actually changes the way that you as the technician interface with your patient. And then we also have a number of companies, including ours. This is not a picture of our company, but have handheld devices. So it allows us to truly get to the point of care and allow us to people to carry ultrasound devices in their pocket at a fraction of the cost of what it used to be to get an ultrasound. Why do we care about? There's a multitude of reasons why we care about ultrasound technology in healthcare. CT scanning is a huge issue. New England Journal article came out 3 months ago looking at ultrasound versus CT for kidney stone patients and looking at outcomes and really showed no difference. So we're pushing away from CT imaging, pushing away from any type of imaging when we can that involves radiation because we know it's cumulative, and moving back to a space with ultrasound. So if we talk about hospital line infections, we put an IV in you in the hospital, you get an infection. Just this one issue alone is estimated to be a $30.5 billion problem that is significantly mitigated by the use of handheld ultrasound or ultrasound devices in general. It allows us to do screening in places that we've never done them before. We can look at, if you go into your primary care doctor and you have a cellulitis here, like this picture here, is there an underlying abscess? Before it was just kind of guess technique. When I trained in Seattle, we would just stick needles in and aspirate, and if we got pus back, then we would know we would have to cut. But now we can actually look before causing any pain to a patient. We actually get an image ahead of time. There's a whole host of screening techniques that you can use now that was not even available 5 years ago for the general practitioner. And these devices are now connected. They are connected to the internet. We did a talk at TED Intel with a gentleman by the name of Eric Dishman who has a kidney transplant. This is online. You can watch it. But essentially, he was at Intel in California here imaging his kidney because his transplant physician likes to monitor the size of the cysts that are forming on this to see if he needs to come in. Now, his transplant surgeon is in Portland. So we did a whole, essentially, consultation during the TED Talk where he imaged himself and his kidney while through Skype, the physician, transplant physician in Portland was watching and commenting on when he should come back up to Portland for his next visit. So we can use, we're actually putting devices and medical devices in places we've never been able to put them before. This actually is taken at Everest Base Camp. Paul Auerbach, who is sort of the guru and the father of wilderness medicine textbook, took this with him up to base camp. The story with this particular picture, Paul's actually imaging there, was, as you can imagine, people spend a lot of money to get up to the base camp. They want to summit Everest. But there are some real serious medical complications that can occur. High altitude pulmonary edema, getting fluid in the lungs can actually kill you. But lots of people are inclined to try and still summit because, well, they spent a year training and, they're going to make it up that mountain. But by being able to show this gentleman that there was fluid in the lungs, they're able to decide to maybe take him down the mountain ahead of time and get medical care. This is a picture in Haiti. So same type of thing where communities who don't have access or the funding to actually traditionally have ultrasound devices, now we can deploy ultrasound devices, 10 of them for the cost of one. into humanitarian situations, disaster situations to help the population at large. You know, one of the interesting things about taking things to the miniature sort of form factor is, you know, kind of like most of us, we carry one thing in our pockets. We're only going to carry one thing. So most technology and wearables have to kind of conform to that ultimately to that. And so in healthcare, it's the same thing. So there's going to be one device that healthcare providers carry in their pockets, and ultrasound's one of those, probably on the forefront, and other things will likely converge into that as the thing they carry. Interhospital communication will be an example. One of your labs back, how do you want to communicate with patients? It's probably all going to be integrated into one specific device as we move forward. You know, I think it was JP Morgan, which is actually ongoing this week here, big healthcare conference. Last year, the big topic was home health. The estimate is that 70% of healthcare is going to move into the home within a decade. So you can imagine devices like ultrasound, or really any other one you may think of in your mind, are going to allow people to stay home and connect with their healthcare providers in a different way than they've done in the past. And these actually are bladder scanners. So this is probably the first example that came out of sort of auto-diagnosis using deep machine learning algorithms to help decide what's the volume of a bladder. So now we take this device, and I could show anyone in 2 seconds how to use the device, and you can get bladder volume. And so for the first time, you can take the ultrasound machine out of the healthcare provider's hand and really put it in anyone's hand. And that's kind of where we want to move, is demystifying ultrasound, creating access. I'm going to shift away from ultrasound and talk about a couple other kinds of medical devices you may or may not know about, and then talk about what the implications or consequences are for healthcare. So this is a 16-year-old gentleman up in Seattle who used a 3D printer, which we talked about earlier, to make a case that's actually a stethoscope case. And so it digitizes heart sounds. Now, why is that important? So if you know the heart has usually two main sounds, but if you have congestive heart failure and you can't breathe, you typically develop a third heart sound. That's actually the first sign of florid congestive heart failure, is the auscultation of that sound. Now, people can't typically hear that on themselves, so they wait till they're symptomatic, they're short of breath, and they go to the ER and see me, but it's a little bit too late. We have to turn them around and get them better, but they typically have to be admitted to the hospital. So if this device can actually digitize that third heart sound and allow you at home to, let's say, put this on your chest 3 times a day, you can actually contact your physician when the actual phone picks up that third heart sound, and maybe mitigate ER hospitals or hospitalization down the road. Cellscope's a company out of San Francisco here that took a mobile phone case and then made an otoscope, so you can actually visualize the eardrum. Now, again, what's the consequences of something like this? Is it just kind of cool gee whiz, or is there something more to it? If we talk about it in terms of finances, which I'll get to in a second, you can see why this is so important to the way we deliver healthcare in the United States. I mean, it's all about cost, right? It's the whole conversation about how we get healthcare here. Can we make it cheaper, more affordable, more accessible for the population at large? So here you just take this video and you can see whether it's a red eardrum or a normal eardrum. But you don't have to figure this out on yourself. This can go through telemedicine channels. You can actually have a otolaryngologist, an ENT doctor, or a pediatrician look at this and say, yeah, you know, that is a red eardrum. And so then they can actually remotely prescribe the antibiotics. So you actually still, 2 in the morning, you're there with your kid who's got a fever and is crying because of the ear pain. You're not driving to the ER necessarily anymore. You're actually just communicating through telemedicine to make the diagnosis. And what that means for healthcare in terms of spending, if you think about it this way, there are over 5 million visits in the United States annually for acute otitis media or ear infection. So that results in typically 10 million antibiotic prescriptions annually and 30 million physician visits annually. Extrapolate that worldwide, and you can imagine what kind of cost savings potentially could be related to the use of a device like this and the way that our, quote, workflow of how we deliver healthcare could change. Another company that's now, I think, out of San Francisco here, AliveCore, you may have heard of. This is the case that gives you a single lead EKG reading. Now, they just had FDA approval for algorithms which actually will detect an irregular heartbeat. So what that means is it's FDA approved that you can use this device to detect atrial fibrillation, to decide when your heartbeat is not normal, So instead of wondering, I kind of feel a palpitation, I wonder what's going on, you can actually have a device which tells you, yes, you actually do have atrial fibrillation, you should probably go to the hospital. That actually is connected to different kinds of electronic medical records. And that's the other part of this, is that as we move to the age of electronic medical records, inputting these different kinds of data points into an EMR, again, sometimes I like to start with the analogy. So I work in Kirkland, Washington, when I'm working as an ER doc. And so sort of one of the hubs of technology in Seattle, our competitor hospital perhaps is 10 miles down the road, also the same area. If I want to get data from their EMR and to me, because I'm seeing a patient who typically is at that hospital, I get it still by fax. Still today. Last night I got a fax when I was working. And so that tells you where we're at right now in healthcare. When I say we're a decade behind, I'm actually serious that like we have a long ways to come. These things don't integrate yet, but we're going to get there eventually. So we keep pushing these devices forward. And I think a lot of it is coming from the technology side, pushing medicine towards adopting technologies that will allow better flow of integration of data. This is a microfluidic technology, sort of easy way to think about it maybe is like a lab on a chip. It's a cheap and fast way to make lab diagnostics available. I'm going to briefly talk about a company, Q, that actually came out of Highway 1, actually, based out of San Diego now. And they're doing sort of home diagnostics using technology similar to what I just mentioned. And so there's 5 different tests. You put your cartridge in there. That white sort of casing device Bluetooth to your phone, and they can give you actual real-time lab data. So no longer are you going to the lab to get a blood test. You're actually just doing it on yourself. I'm going to run through a specific scenario here. And so when I'm working clinically right now, we're seeing almost twice as many patients as we're typically seeing due to influenza right now. In the state of Washington, on a call yesterday, we're still 3 weeks away from the peak. We just crested above the 5-year high in terms of volume of influenza cases. So this is a real deal problem in the United States. People get really sick from the flu. So you have the typical symptoms, let's say, and you have fever, sore throat, cough, you have influenza. You happen to have the Q test, the Q diagnostic kit at home, and so you run a flu test on yourself. That device goes to your phone and says, yep, you have the flu. That communicates with your healthcare provider who says, you have the flu. That healthcare provider then can prescribe you medication for influenza, which for the purpose of this example, let's say is couriered by a local courier service, because there are a couple of those set up now with Walgreens and such that you don't actually have to even go get the medicine. And then you are still at home in bed, feeling not particularly good, but more importantly from a healthcare and preventive medicine standpoint, you're not out there making other people sick. So we can help mitigate the spread of disease with technology like this. We also can get huge amounts of data. You can imagine how much data we could develop here. If you know how Google Flu worked, this would be a much better way to actually truly understand flu trends in the United States, because it would be real-time diagnostic data. The Human Microbiome Project is an ongoing project. So just in a 30-second review, this basically is stemming from the fact that we have learned ways to figure out DNA sequencing from things we could not typically plate out on traditional agar methods. So if you wanted to prove that a bacteria existed, you would sample it from something, and then you would grow it out on an agar plate or something, and then you would demonstrate that that actually did exist. But now, through other techniques, we can actually extract the DNA out of those cells, even though we can't necessarily grow that bacteria in live medium. And we've discovered over 1 million genes. So this is an ongoing project at the NIH. There's companies like Ubiome out here in San Francisco that allow you to order a test kit. I think they have another Kickstarter campaign going on right now. And you can test your saliva, urine, stool, all that stuff. You send it in, and then you basically become part of that project. You can imagine here, you can get some interesting data out of that and how your data in your human microbiome relates to other people who maybe have similar disease processes you do, who live in similar areas of the country. There's lots of stuff that we may be able to derive from this kind of data that we've never had access to before. Now, this isn't hardware, but if anyone's familiar with patients like me, it's an amazing story. This is where people can input their own data. about their own healthcare, and then they can find people who have similar demographics to learn other ideas about how to treat their medical illnesses. So we can start to input hardware data, medical device hardware data into systems like this to better understand how to treat specific disease processes. So the Tricorder Prize is ongoing. We're to the final round. This has been ongoing for a couple years. It's a $10 million prize. There's about 10 categories of things that they asked the companies to come up with in their medical devices, and there was another category of things they could choose from. I don't think anyone's going to get to the actual number that they were hoping, but if anyone's heard of Scanadu, they're one of the finalists. And so this device, you run it on your forehead, and it gives you quite a bit of data, maybe not as much as they were hoping for when they started the prize, but a profound amount of data: temperature, blood pressure, heart rate variability, pulse oximetry, and allow us to start to connect that data with others maybe in the same area, maybe people who are doing the same types of things we're doing. It's unclear on the extent to what that data can be utilized. But they had probably one of the largest crowdfunding on record. I think it was 1.6 million plus their VC funding to help develop this technology. This technology was actually just released at CES 2 days ago and was just written up in the New York Times this morning. So Bloom is really fascinating. So what they did is they took the ring that typically you'd use for secreting estrogen for contraceptive, and they took that out, and then they put in a temperature sensor. So what this allows is for real-time data on core body temperature, so that families that are trying to conceive can actually see core body temperature spikes, and that will be Bluetooth to their phone, so they'll know when the appropriate ovulation time is. So pretty fascinating. Propeller Health's a little bit one of the more popular ones. They basically took the inhaler. So there are 50 million people in the United States using inhalers right now. So imagine the amount of data sets we're creating where we can actually understand. People always underestimate how many times they press the button. I only do it twice a day when they do it 15. So this allows us to not only understand how much you are using your inhaler, so as a healthcare provider, you can say, you're using it too much, we need to change your baseline medical dosing, but also can give us real interesting data about geography. When is it you need your inhaler? What type of temperature is it when you need your inhaler? What type of environment? What parts of the country seem to pose a problem for you? Lots of types of question that typically, historically, was just subjective. Now we actually have real-time data to understand when you're actually accessing your inhaler for rescue medication. So it allows healthcare providers to interact. Here, I don't think I would want this personally, but here it is, a text message demoing, going to like the healthcare provider saying, hey, one of your patients is doing poorly. Lyft is I just wanted to finish with Lyft because I think that initially when I heard about this, I wasn't exactly certain how profound this is going to be, but I think that it's not connected per se. But I think the consequences for medical devices like this are profound, probably best demonstrated when I saw this video. I don't know if anyone's seen this video here. See if I can make it run. There we go. So this is a gentleman with Parkinson's trying to eat, and then when the Lyft spoon, which counterbalances the shaking of the patient, allows him to actually functionally eat his food in a much more simple fashion. So I finished with that because, as an ER doc, I typically treat symptoms. You come see me because you are in pain, because you are sick, you can't breathe. I mean, yeah, you have a diagnosis, maybe you don't know what the diagnosis is, but I spend most of my life trying to treat and alleviate symptoms first, and then we try and figure out what the problem is. But if you're in pain, lots of times you care about that first. You want the pain to be relieved. That's why you're coming to the emergency department. So I think that along those lines, a lot of these medical devices can treat both diseases but also symptoms or byproducts of disease and improve quality of life, make people happier. Because that's ultimately, as healthcare providers, why many of us went into it, was to help people. And so I think that this is a whole new generation of medical devices that will allow a new type of engagement between healthcare providers and their patients. And for me, that's a very exciting time because that's exactly what I think people went into healthcare for. So just leave it with any questions here. This This is actually one of the earliest medical devices in modern times. This is the Bacon's leech device. So instead of putting a leech on someone thought this would be a great idea to suck blood out of your skin and get rid of the evil humors. I don't think that would pass muster these days, but so thank you for your time.